Hello everyone, and in today's video I would like to talk about the links between different sorts of training methods and atrial fibrillation. So just obviously huge massive disclaimer, I am in no way medically trained. I'm not a doctor. My degree is in mathematics. I have over a decade of coaching experience and the qualifications to go along with that. This is purely a video about what I found through looking at research into how different training methods have different effects on your body in general and how you perform, but also with your health, and in this video, atrial fibrillation. So I just wanted to share what I found, share some of the studies that I found. It's also worth noting a quick disclaimer. The method that I believe is the safest is also the method that I already prescribe to people when we're coaching them. So I want that to be clear that there is also a bias here. But again, this video is not medical advice. If you've ever had any health issues, and particularly atrial fibrillation, consult with your medical professional. Do not use this video. So I'll cut to the chase, and what I found and what my hypothesis is that polarized training is the best method if you're looking to continue to do an endurance sport, and in this situation rowing, but again it can also apply to cycling and running and other endurance sports. Polarized training is, from what I've seen, the one that puts you at the least amount of risk. Again, polarized training can still put you at risk. There is still a lot of stress involved with it, but just when compared to the other methods that we're going to compare in this video, then that's in my opinion what has stood out. At the same time, polarized training is the best training method regardless, again in my experience and from what I've read and what I've seen, regardless if you're a masters rower or if you're an elite rower training for the Olympics. It's the best for recovery. It's the best if you have a job and you're struggling to recover. It's the best, to be honest, for enjoyment as well. That's a massive thing that we've noticed, is that generally it's like an easier program to do consistently. I'll quickly just describe polarized training for those that don't know. Essentially what it is spending around 80% of your time at very low intensity and then 20% of your time at very high intensity. Again, that high intensity part is still potentially something that people would want to avoid if they're looking to prevent or minimize their risk of AFib, which is atrial fibrillation. I'm going to call it AFib because I struggle to say it. But again, I'm not just going to make the point that I think it's the best. I'm also going to, at the end, walk you through how you can go about applying it. But again, an example of how polarized training would work, say you go for a row 6 times per week. Polarized training would have you about 4 or 5 of those rows would be very low intensity, and then 1 or 2 of them would be very high intensity. So AFib in endurance athletes is primarily caused by increased vagal tone, which is basically the nerve in your heart. So it's increasing the activity of that nerve. Atrial enlargement, which is basically, to put it simply, enlargement in parts of your heart. Inflammation and fibrosis, which is basically, well, one, obviously inflammation, but also micro tears and micro scarring. And then autonomic imbalance, which is basically your body's flight response. And again, when you're training too hard, when you're not recovering, you're basically just constantly putting your body in the sympathetic state, which is just kind of constantly having it in the fight or flight state. So some of the symptoms of AFib are heart palpitations, a noticeable reduction in performance. So maybe not like, you've taken some time off or you're just in a bit of a slump with your training. It's like a kind of significant and strange performance decrease. Shortness of breath, general sort of fatigue and weakness, and then also dizziness and lightheadedness. So again, the diagnosis is not watching this video and then taking on what you learn and then trying to fix it. The diagnosis is going and speaking to a doctor, looking at altering your lifestyle, which again is slightly different for endurance athletes, but that's more so reducing the amount of exercise that you're doing, particularly high intensity. But sometimes what endurance athletes will still do is excessive caffeine, excessive alcohol, not recovering well. So not sleeping well and not eating well and not staying hydrated enough. So there's also medications that you can go on, which again, I'm not going to give advice on. And there's also surgical procedures that you can do. And just from what I've read, from what I've seen, it would appear that changing the way that you train can minimize these factors that influence your risk of AFib. So as with most health conditions, there's always genetic influences. There's always non-exercise related influences like stress and general health as well. But what was jumping out to me when I was reading and researching into this is there's sort of 5 general training related, that could be strongly related to training, 5 factors that could potentially influence your risk of AFib. So the first 2 are hormones, which are basically adrenaline is the first one, which is also known as epinephrine, which is produced through doing mid to high intensity exercise, and then cortisol, which is also produced when you do mid to high intensity exercise. The third, again, we've kind of all gone over this already, but is the vagal tone, which is kind of the activity of the vagal nerve in your heart. So the fourth is sort of the structural changes, so the largening of the heart. And then the fifth is the inflammation on oxidative stress. And that essentially can cause the kind of micro scarring, the micro tearing of the heart tissue. So now in this part of the video, I'm going to go into the kind of what I see as sort of the 2 most common approaches that rowers and some endurance athletes have, and why they put people at risk of increasing their AFib. So there's 2, I would say. There is the sort of like more modern approach, and then there's also the old school approach. Again, from my end, I think they're both bad for performance in general, but also more specifically for this video, and obviously more importantly, bad for heart health. So the old school approach is generally doing hard training every single day. So every time you're down at the boathouse or you're on the erg, you do your training as hard as possible. And yeah, maybe sometimes your stroke rates are higher or lower, or it's rate capped, or it's longer, or it's shorter. It's generally always high intensity. You're in the boat, you're on the erg, you're going as hard as possible. The modern one, again, it's more modern, it's more common right now, and it's probably became more common from the 90s onwards. But low intensity training, or what would be described as low intensity training, but then just doing that low intensity at kind of the mid intensity and not actually making the low intensity low enough, while also still doing really high intensity training as well. So I would say that this modern approach, which again I still think is wrong, is modeled after a proper polarized training, which not enough people do, not nearly enough people do, in my opinion. But it's modeled after that 80-20 split. But what ends up happening is that 20% of the time they do the high intensity, do that part right. But then the 80% of the time they do their UT2, which is their low intensity training, which is, again, I'll go into this a little bit, but zone 1 out of zone 3 or zone 2 out of zone 5, they do that, what they think is that zone, way too hard. And they think that pushing in that zone improves performance. And all it does is just increase your risk of increasing adrenaline and cortisol. So to go into the old school method first, which is the high intensity training, I'm just calling it old school because this is just through my experience. To go into that approach, what happens when your body does high intensity exercise is, yes, you do produce adrenaline. Basically, kind of when you go into that mid intensity onwards, you start to really burn into your carb stores, which again is fine from this perspective, but it's more so the production of adrenaline and cortisol that happens in that high intensity zone. But why high intensity? That's not a problem for high intensity, is because it's such a high intensity, you fatigue fairly quickly and you're not able to do it for a long amount of time. So generally the amount of adrenaline and cortisol that gets produced is less, because you're producing adrenaline and cortisol, but it's only for a short window because it's high intensity. Where the problem with repeated high intensity training, old school training as I'm referring to in this context, is you're just constantly beating the shit out of your heart, for lack of a less scientific word. You're constantly stressing out that nerve in your heart. You're constantly putting your heart in that fight or flight mode. You're constantly putting your heart at risk of causing the growth that we don't want. You've got that constant inflammation and oxidative stress that increases the risk of those micro tears and those micro scarring. The medical word for it is fibrosis. And again, in the general terms, for most rowers, like that is healthy. You can say it's good for performance, you want that, but the other thing is it takes at least 48 hours for your body to recover from that. And again, if you're doing this every day, especially as you get older, your recovery becomes harder and you're not giving your heart the chance to bounce back. This is, again, I heard someone talking about this before as well. Again, a factor I should have talked about as well is as you age, you become at a much higher risk of AFib. And some of the evidence that's shown with the way your body ages with performance is that your endurance doesn't decrease at the risk that your high intensity power output decreases. So your high end power decreases faster than your low end power. So a lot of the time masters think older athletes think that they have to spend more time doing more high intensity training because they're working on their weak areas. First off, again, this is a bit of a tangent, but number one, working on your low intensity does improve your ability to work at the higher end powers in those 1K, 2K, 5K races. But more so, it's just the more time you spend doing that, the harder it is to then recover from those high intensity efforts. So just wanted to put that sort of branch out there. So now, as we move more towards modern training methods, which again, I still think are wrong. This is where, there's still the stress of the oxidative stress and the stress on the nerve in your heart. This is more so about the hormones that get produced. So once you kind of cross, the simplest way I think you can go about, and I learned this from Charlie Simpson, who's the author of Advanced Rowing, and he talks about splitting your zones. To keep it simple, split your zones into 3 zones. So there's zone 1, zone 2, and zone 3. So when I was talking about that old school training method, zone 3, the high intensity, just constantly doing zone 3 of 3. Again, if you're going to compare this is where it can get a bit more confusing than it needs to be. So don't worry if this goes over anybody's head, but this is where in the zone, if you're using a 5 zone model, 1, 2, 3, 4, 5, that zone 4 and 5 can be sort of linked to zone 3. But anyways, thinking about training, like the 3 zones, 1 is the lowest intensity, 2 is the mid intensity, 3 is the high intensity. Once you cross that from zone 1 into zone 2, the way that your body produces energy changes. It goes from primarily using fats and your aerobic system to using carbs and more in towards your anaerobic system. And again, to assist that production of carbs and to increase your heart rate and to put your body into that higher state of stress so you can produce that power that's needed, your body produces the adrenaline or the epinephrine, which again you don't need to worry about, and the cortisol. And what happens when you start to produce, because when you go into this zone 2, this mid-intensity zone, it's not hard enough that you fatigue and you burn out, but it is hard enough that you start to produce these like quote bad hormones. And again, there's no bad hormones. We need adrenaline, we need cortisol. But in that mid zone, it's not hard enough that you fatigue, but it is hard enough that you start producing those kind of higher stress hormones. And because it's not hard enough, you can keep going and keep going. And what happens is you just keep sort of topping up your adrenaline and cortisol at a faster rate than your body can get rid of it. So what happens with modern training approaches is you're either spending a lot of your time in that zone 3, that super high end intensity, which again is okay in some ways because you're not producing it for a long amount of time. Again, this is zone 3, that high end intensity is one of the first things that doctors will recommend you don't do if you're at risk of AFib. So I want to make that clear. I'm just comparing the pros and cons here. But going back to zone 2, this is the zone that when people do their low intensity or their quote low intensity too hard, this is more where the dangers come from it. And you're just constantly, every time you're in the boat, you're just producing you're producing the adrenaline and cortisol, and you're doing it for a long time. So you really just build up high amounts of adrenaline and cortisol in your system. So, and now this is linked with the high intensity, but what the adrenaline and the cortisol does. So the adrenaline basically stresses your heart out more, and it causes it to beat quicker, which stresses out the nerve. The cortisol is more linked with increasing inflammation, which again can be more linked with the stress and the fibrosis and the scarring of the heart. And I'll be putting studies that show all of this down in the description. Now, I'd like to get to the point in the argument of why, from what I've read, in my opinion, in my non-professional opinion, and again, this is not medical advice. If you think you're at risk of AFib or you do have AFib, this is not advice that you should follow. Everything should be cleared by a doctor first, and you should go and speak to your medical professional. But just from what I've read and from what I've seen, this is where polarized training avoids some of those risks. Now, polarized training, of course, there is still risk. There's still massive risk with polarized training when it comes to AFib. However, it would appear that polarized training is the lowest of those risks. Polarized training still includes high-intensity training. So number one, if you're at risk of AFib, that is one of the first things that you're going to want to get rid of is that high-intensity training. However, in a healthy person, in a healthy heart, when you do high-intensity training properly, you can recover and you can do your high-intensity efforts every 2 or 3 or 4 days or whatever. And the training in between those high-intensity efforts is actually low enough that you can recover from those high-intensity efforts. Again, in the more modern version, you do the high intensity effort and then you go down to mid intensity and you're not really recovering. Both of them are high risk, and you're doing the super high stress activity, and that mid intensity that people view as low intensity incorrectly doesn't allow them to recover from that. So this is where polarized training may be slightly better, where you do the high intensity effort and the low intensity is low enough so that you can recover it and bounce back. Again, another study that I'll link, taking a step back here, and if we were to compare mid intensity versus low intensity, and two athletes, you had them doing 60 minutes at a time of the low intensity versus the mid intensity, what has been shown is that, in the study I'll link below, is that both athletes, or say it's a group of 10 people doing each of these, I can't remember exactly what the study is, but if each of them are a group of 10 people doing the low intensity versus the mid intensity, each of them, the higher, the increases that athletes can experience from both of those modes are basically the same. So when athletes perform on both of those, the increases are the same. But what happens is with the mid-intensity group, that threshold group, which is another word I'm going to put out there to confuse you, is also very high risk of overtraining and actually going backwards and underperforming. So again, this is just another reason that polarized training isn't just better for general health, in my opinion. It's also better for performance and recovery. Now, again, a lot of the research on AFib is fairly new, and one thing they have concluded is that high intensity does put you at risk of it, but at the moment, there's not any conclusive evidence from what I've read and seen that low intensity, and necessarily doing longer low intensity training and exercise isn't linked with AFib yet. But again, perhaps part of the problem is that most people that do low intensity training already do high intensity training. So that's why it's maybe hard right now to remove those variables and conclude that low intensity training doesn't put you at risk of AFib. So again, this is like physiological proof. This is like physiological fact that when you're below the mid intensity, when you're in proper low intensity zone 1, you're not producing adrenaline, which is causing your heart to go crazy. You're not producing cortisol, which is increasing that inflammation. You're not stressing out your nerve. You're not putting your heart into an oxidative, inflamed position. You're just working at a super low stress, low intensity effort, low energy effort that's easy to recover from, which again, as a result, puts your heart at a far lower risk. Again, the low intensity training increases the efficiency of your heart, can improve the consistency of your heartbeat. It improves your blood flow. It improves your oxygenation of your body. And again, a really big thing is that it prevents overtraining. So this is the part where we'll get into how you can actually do polarized training. Again, this is only if you've been cleared by a doctor. And even then, this is not even advice. This is just for anybody that wants to gain the knowledge on how to do polarized training. Essentially, some of the factors that you can use, it'll be easier. I'll put the tools in the description that you can use that we've given out before. You go down, use some of the tools, put in some of your splits, some of your heart rate, your age, and it'll give you some predictions on how you can figure out what your low intensity training is. With polarized training, the hard thing isn't trying to figure out what splits you should be doing for high intensity or what high intensity efforts you should do. When it comes to polarized training, the hard thing is just making sure that you go easy enough. And a lot of the time when people do low intensity training, it feels too easy. And this is a big problem, is that rowers like hard work. They like that feeling of improvement. They like to push their body. And a big problem is that when you do low intensity training, it feels like you're doing nothing. And there's just that thought that this can't possibly be working for us. So that is probably the hardest thing. It's more so probably the best advice I could give on it actually is it's a mindset thing. It's understanding what's the objective of your training. And with low intensity polarized training, when it comes to the lower end, it's all about getting into the training zone and staying there. And that's all you need to do. It's not about power. It's not about improving your splits or whatever. It's just about getting in that zone and staying there. So again, I'd suggest checking out the links below. That I'll link right at the bottom. But you can use a percentage of your heart rate. So that's generally from what we found. Some people say 60 to 70% of your max. In my opinion, from what we found from our data, 65 to 72% is fine. As you age, that doesn't drop as quickly as your max heart rate drops. So that can stabilize a bit more. Generally, from what I've seen, as you get into your 60s, 70s, You don't really want to go below like 110, but again, we'll put that's where you kind of be better off using your splits to calculate, using some of your personal bests to calculate that. But again, if you have AFib, that's not something you might be able to do. Obviously, you wouldn't be able to do a maximum 1K or 2K or 5K effort. So again, I'll link some stuff below on how you can use it. The other big thing on recovery that most people do wrong is they don't do long-term planning, which is something we go on about all the time. Cyclists do it, endurance triathletes do it, runners do it, rowers don't do it. We just think more every week. And essentially the best guidance I can give on this is a whole nother topic, a whole nother video, is every 3 to 6 weeks, have 1 week where your total mileage for the week is like half of what your average is. So say on average, you do 3 to 4 low intensity rows per week, and on average they're around 45 to 60 minutes. My advice, if you were to go into recovery week, a light week every 3 to 6 weeks, would be have those 3 to 5 low intensity sessions, have that volume around 20 to 30 minutes where you just really drop the volume down and really let your body recover from the volume. But yeah, again, this is my opinion. This is us at the end of the video. This is just my opinion, my experience from what I've read. I'm in no way a professional. I'm in no way in a position to be giving medical advice. If I haven't said that enough already. Again, I'm just sharing some of the insight and some of the stuff that I've been reading. I love learning about this stuff. I love understanding the body and the physiology above it. Again, it's important to remember, I go on about polarized training all the time, so I do have the bias going into this of wanting polarized training to be the best method for minimizing risk. But again, I would like to think if it was showing that polarized training was better for AFib, which, I mean, even logically that doesn't make sense, but I would like to think that I would recommend people don't do it. But anyways, if you found this video helpful, yeah, share it with somebody else that you feel like it would be relevant for. Again, you can comment, but I'm in absolutely no position to answer questions and give advice. If you've had difficulty with AFib, maybe you could share your experience in the comments. That could be something that is useful. But again, even then, don't follow the advice in the comments. People sometimes give their opinion on what has worked for them. That is not advice. Make sure that you speak to a medical professional. Cool. All right. Yeah. Go check out the links in the description. And yeah, wishing you all the best and a safe and happy and healthy rowing journey wherever you are. All the best. Cheers.